Hey, Colin Hubler here, Doctor of Physical Therapy with S3 Balance. How are you today? Boy, this is a lot of fun, isn't it? This prolonged confinement for everybody. But one particular population, these older adults, sustained confinement, social isolation for weeks, maybe months on end. We've got an even potentially bigger problem on our hands brewing other than the virus. And I'm talking about due to sedentary or inactivity. Being sedentary and not doing anything for weeks on end is catastrophic, especially for older adults. We're talking about muscle wasting, which can lead to falls, immune system compromise, back pain, knee pain, COPD, heart disease, complications from diabetes, pressure ulcers, throwing a DVT, a blood clot, anxiety, depression. I mean, all these things. So it's not enough just to keep people safe from the virus. We have to start thinking next step, which is how do we keep people alive long term? Because right now, with people not getting up enough, we're asking for a whole host of problems later. So we have a simple program today. It's called Beat the Virus, and two-sided handout. It's right next to this video at s3balance.com, but you can just click, download, and print PDF, and really easy to do. But the idea is just to interrupt this cycle of sitting, because again, if you have a plant that requires water every day, and you don't water it every day, it's gonna die. And older adults arguably are even more vulnerable than plants. Okay, so we've got to care enough to get them up and take good care of them in addition to keeping them safe from the virus. Okay, so second step. So today, come with me, we have my mom. Thanks for joining me today, Mom. So we're going to go over some very simple things that you can do. All you need is a kitchen counter. That's it. Okay, and again, this is not going to give you big gains in strength or even balance. The idea is just to interrupt this cycle of sitting. It does wonders to reduce the problems associated with all those problems that I told you before. Okay, and they can do it on their own, and they got to do it at least a couple times a day. Ideally, every hour. The more they do it, the better off they're going to be and the better they're going to feel. Okay, so notice I have a stool here. If you have a chair or something. If the person gets tired, no problem. They can take a break, no sweat, all right? So the first one we're gonna do is tandem or just heel toe. So you're gonna have the person, they're gonna face the kitchen counter. They're not gonna let go of the counter at all, okay? Not even a little bit, but they're gonna go heel toe, okay? So it's called tandem, looks like a tightrope, right? So she's going heel toe. And then now it's breathing. So she's gonna pull her shoulder blades back. And we want to really get some deep breaths, breathing through the rib cage and expanding the rib cage. You tend to lose this as well the longer you sit, especially if you're older. So you're going to hold this for 30 seconds, maybe a minute, and then switch feet. The next move is a little bit more aggressive. It's the squat, and it trains the muscles that we need probably the most just to prevent falls and to get up. Okay. So go ahead and go shoulder width. Good. So she's going to put her feet shoulder width apart here. See that? She's holding on. And then what she's going to do, she's going to squat down until she hits a point where she feels like this is moderately hard. This will be different for everybody. Okay. But there is a point where we don't want anybody to go lower than. So go ahead and squat down, Mom. So she's going to squat down. Their first motion is her hips going back. Notice the knees are not going forward. And they're not going inward. That's very common. Don't let the knees go in and don't let them go forward. Keep them back and keep them out. Okay? So they're here, and that's as deep as you'll ever want to go. Is that moderate there?
Yes.
Yeah, so it's moderately hard for her. That's enough. Now she's going to do her breathing again. She pulls her shoulder blades back. Breathe deeply and then exhale. You can hold this for about 3 seconds or so, and then up. And then you repeat. And again, you're just trying to get to a moderate level of difficulty. Nothing extreme here. Next is a plank or like a push-up. It depends on the skill of the person. Mom, go ahead and put your hands wider than shoulder width. Okay, they're wider than shoulder width. And then now she's going to go up on her toes. And then she's going to walk back. And she's going to walk back to a point where she feels like, this is moderately hard. Let me know when you're there. Okay? So she's there. So it's moderately hard. Now, and this is optional, but she can do a push-up. So she's going to actually bend her elbows and she's going to go down. Again, whatever she can do to about no deeper than that. And then she's going to go up and then right back down again and breathe, please. You're looking, again, deep breaths. You're trying to take deep breaths through the rib cage there. And then up. See how rigid she's keeping her body and she's staying up on her toes. Good job. Again, that's going to be different for everybody. A lot of people will not be able to do the push-up at all. They may just get into that plank position and that's it. And then just work on your breathing. Good job. And that gets the hips, even the thighs, the tummy, the shoulders, the chest, the arms, and even the neck. Okay? So now, go ahead and turn and face the counter. This one is going to feel really good, especially if you sit for too long. Actually, all these do, but this one in particular. So she's going to take her fists, she's going to make fists, and she's going to put them on the counter. And then now she's going to walk back, keeping her arms straight, okay? A fair number of people will stop probably right here because of shoulder stiffness. Can you go farther? So she can go farther, and she's going to keep going until she feels like this is a moderate stretch. But this stretches the shoulder, the low back. It even works the neck because you're having to keep the head up, the hamstrings, and the glutes. So it's a stretch basically almost through the whole back side of your body. Does it feel good? And then go ahead and stand back up. And then you're going to work on your breathing when you're down there, same as the others. But notice the position of her hand. Her hands were like this. Don't put the hands flat down like this. Why? Because then when you go down, these two bones come together and there's tissue between those. It's called impingement and it can really cause a lot of pain, especially for those folks that have a rotator cuff injury or bursitis or just plain arthritis. So make sure that you have a fist with the thumbs facing kind of upward, or even better, you can go palms up, but it's a more intense stretch, just so you know. Good, Mom. Okay, and then now we're gonna do a calf raise. So she's gonna go close to the counter. She's gonna hold on, okay? She's still holding on. And then now she's gonna go up, and notice how she went forward when she went up, which is just fine, okay? That's just fine. But you can make this harder by kind of reinforcing with your hands. Now go ahead and go up. And then now she's gonna kind of stay back. Is that harder? Yeah. So when you stay back, it's harder. So whatever somebody's willing to do, you're going for moderate here, keep going. And then don't hold it, just go up and down. It's just up and down. Good job. And again, just looking for moderate, nothing intense here. Good job. And then second to last is a calf stretch. This one feels good too. So Mom, go ahead and walk back and let's do your left calf. So she walked back. Now she's just gonna leave her left foot there, but she's gonna take her right foot and move her right foot forward while keeping that back heel down. And she's gonna try to really extend that left knee, okay? Is that a moderate stretch? So she's got a moderate stretch. Her chest is up, and if she needs more stretch, she can just, nope, this stays here. She just moves her pelvis forward, see? Or you can just move the foot back, okay? Good job. Yeah, no, you're good. And then the last one, let's go ahead and do the march. The last one is the march. Now you're gonna be away from the counter. The longer your arms, the better for this one. And she's gonna march in place. So Mom, go ahead. You're gonna lift up one knee as high as you can, and then the other one. And again, I'm watching her breathing. No holding her breath, and she's trying to expand her rib cage. Nice job, and you're trying to get those knees up. Don't hit the counter. If you do, you need to back up a little bit, okay? Good job. And this one, you wanna go for 2 to 3 minutes or even longer. This is more for endurance. Get that heart going, get the muscles going, get your brain turned on a little bit better. Good job, Mom. So this is the program. We call it Beat the Virus, okay? If you have any questions, you can go to s3balance.com. You can email me at colin@s3balance.com. But please, I can't stress enough that doing this for older adults is like giving someone your canteen in the desert. I can't stress it enough that every day that somebody doesn't get up and do something, you're taking time off their life, okay? We owe it to them to take better care of them for long term as well. I really appreciate your dedication and help. Good luck.